Health is wealth. Prevention is better than cure. Early to bed, early to rise makes a person healthy, wealthy and wise. We have grown up listening to all these sayings about the importance of health and why we should take care of it. Why then do we not listen to the experts and take our medical advice from baseless social media posts? Before we try to answer that question, let's first get a sense of the kind of health-related fake posts that are popularly found on the internet. A lot of it is a marketplace. There are miracle drugs to cure hypertension, diabetes, and eyesight problems. Within this is a range of products to tackle obesity. Weight loss sauna blanket, weight loss patch, and even a weight loss ring. There are also posts that push natural cures as the way forward. Things like coffee and lemon juice mixed in water being a good solution for, again, weight loss. And coconut oil applied on the lower legs being a preventive measure against dengue. With one-shot medicines, we can easily say that the post is fake because our investigation reveals that the product being sold is not an approved drug on reputable medical bodies' websites. But natural cures are not so easy to tackle. Things like lemon and coconut have been used for ages to help manage health conditions, and they may even be proven to be useful. For example, turmeric has been used in South Asia for a long time and has been found to have antiseptic properties in scientific studies. But that doesn't mean that we can start believing that these things can completely cure difficult health issues. So here, we must double down on our reliance on existing scientific research while tackling the claims. The coconut oil application to prevent dengue was easily debunked because there was no evidence to support the claim, which was itself incoherent, as it called coconut oil an antibiotic while dengue is caused by a virus and not bacteria. But the coffee lemon water weight loss drink was trickier because while one study claimed that coffee consumption could slightly boost the weight loss process, a metabolic health physician said that the study could not be taken seriously. And there was no direct link found between the consumption of lemon water and weight loss either. Things get even trickier when both these things, that is miracle cure and natural remedy, are balled into one. One post said that a doctor had said that drinking hot coconut water kills cancer cells. Of course, neither did a doctor say such a thing, nor is there evidence to substantiate the claim. The COVID-19 pandemic gave rise to a slew of fake posts. Yes, vaccine hesitancy was one of the main themes, and while we are not qualified to talk about how effective these vaccines are, what we know as fact checkers is that the vaccine was not used by the government to embed microchips in our bodies, and it definitely does not turn people into zombies. Yes, these were actually some of the claims made during the height of the pandemic. Several other posts made all sorts of claims about the disease, so much so that we ended up making a video outlining the different types of COVID-19 fake news during the first lockdown in 2020, which is linked in the description. Another kind of non-medical health advice we sometimes come across on social media is celebrities and influencers sharing health tips. We won't name any names, but there have been enough cases of famous people either gunning for home remedies to manage everything from the flu to acne, or endorsing unscientific products like weight loss teas. Let's return to the question I asked in the beginning of this video. Why do we turn to social media for health advice? We can answer that by tackling the question of why people create and share such posts. The way we see it, there are three primary reasons behind this type of misinformation. One is concern. Think about it. We all probably know at least a handful of people who are diabetic. It is unfortunately that common in India. So, when we see a post that advertises a product that can reverse it or a home remedy that can help manage it, the instinct is to share it because we think this information can help our loved ones out. The second reason is fear. It is true that big hospitals are intimidating, that formal medical treatment can be extremely expensive, and that insurance companies sometimes make claim settlements too difficult and tedious. There have been documented cases of the organized healthcare system putting their own profits above the well-being of their consumers. In such a scenario, it is not difficult to imagine that the public may grow mistrustful towards these institutions and to Western medicine as a whole. And this in turn makes them more likely to 1. Be drawn towards alternate treatment methods like nature therapy, and 2. Dismiss medically sound advice shared by reliable sources. The third broad reason for the existence of such posts is not as altruistic or sensitive as the other two. It's money. Anytime you see a post that pushes you towards a link from where you can buy a product, or a phone number or social media account where you can order something through direct contact, they are not there because they care for you or your family. They just want to turn your concern and fears into cold, hard cash. It's easy to get carried away in such situations, but a little bit of logical thinking can set things straight. If you look at some of the miracle cures we spoke about earlier, you will find that these are often meant to treat, finish off a difficult health issue. There's one post that advocates the drinking of warm water to tackle a whole laundry list of health problems, from somewhat smaller issues like bodily discomfort to the big guns like cancer. That's right. A poorly designed pamphlet says that drinking warm water can resolve all types of cancer in 9 months. If it was really that easy, why wouldn't oncologists across the world be prescribing warm water therapy? It would be to their advantage to advise patients to drink warm water consistently, because when these patients' difficult cancers are resolved, the doctors would get to gloat about the number of patients they have cured, catapulting them to fame, success, and riches. Similarly, had people really lost significant amounts of weight by drinking something as simple as coffee powder and lemon juice mixed in water, they would surely have been shouting it from the rooftops, given the popularity of weight loss content on mainstream and social media. Some of you may object to what I've said until now, maybe because you have experienced better digestion since switching to warm water, or because your dietitian did ask you to drink coffee lemon water first thing in the morning. This is where nuance comes in. Yes, warm water may help your stomach feel settled, but you'd still experience discomfort if you were to eat overly greasy or spicy food. As for the coffee lemon concoction, sure, the nutritionist may have recommended it, but they would also have shared a diet chart that advocates overall healthy eating and probably shared suggestions on a doable workout routine. What I'm getting at is that just warm water or just coconut oil or just any one thing cannot correct a health issue. That is unfortunately not how science works. Health and medicine are complex things, and especially when we're talking about life-threatening diseases like cancer or life-altering conditions like diabetes, it has to be understood that there is no one-size-fits-all solution. The treatment will depend on one's genetics, past issues, lifestyle, and many other factors. This is why doctors ask for your medical history so they can come up with a treatment plan best suited to you, as opposed to a generic template that can finish off your problem in one shot. Having said all this, you may now wonder why it's a big deal if more people trust such posts and switch to healthier habits like drinking warm water. Sure, it's not a problem if they're just doing it for overall health, but the minute they start to believe that it can cure migraine forever or that uncertified eye drops can improve their eyesight is when things really start to go downhill. The obvious problem with buying these products that aren't prescribed by any medical professional is the loss of money. You may place an order, pay up, and then never actually get the product, or worse, get it, start using it, and realize that it doesn't work or is making your condition worse. And that's the bigger problem with falling for health-related misinformation, the loss of health, which is honestly more alarming than the loss of money, because remember, health is wealth. And with grave diseases like cancer, a patient choosing hot coconut water over oncologist-approved treatment can be the deciding factor between life and death. With cancer treatment, time is of the essence, and we are not just saying this. We spoke to two experienced oncologists when we did a 2-part deep dive into misinformation on cancer in our podcast Unviral, which is available here on our YouTube channel. We've established that misinformation about health is undesirable, so the next question is obviously how to tackle it. The standard things apply. Keyword search to check for vetted medical information supporting or disproving the claim, and sending the claim to us fact checkers if you're still in doubt. Remember, we have a WhatsApp tip line where you can do that. But with health misinformation, the first thing to keep in mind is that health is complicated. There are no easy solutions, especially to things like cancer, diabetes, and obesity. So these miracle cures cannot be trusted blindly. Medicines must always be prescribed by registered medical practitioners. Your health is too important to gamble away over uncertified eye drops and blood vessel cleaning pills. Not just medicines, any form of treatment, including natural cures and lifestyle changes, is best run through your doctor. A certain herb or practice may be great for some, but what if it interferes with your current medication or exacerbates a condition that you have? So, with health, always opt for medical advice from registered medical practitioners and nothing less. Because if you think about it, if you take a chance with something you learned from the internet and it doesn't go well, you will ultimately have to turn to the doctor to fix your problem. Better go to them in the first place, because remember, prevention is better than cure. The same goes for the health advice doled out by celebrities and influencers. Ads for miracle products can be ignored straight away because the celebrity is clearly in it only for the money. But even when they share tips like meditation and steam inhalation as cures for depression and the flu, we need to remember that all health, including mental health, is subjective. What works for one person need not work for another. And so, at the risk of sounding repetitive, check with your doctor before you accept any health-related tips, even if they are endorsed by a celebrity or fitness influencer you trust. Let me repeat a slightly modified version of something I said in an earlier episode on misinformation around history. It's a lot easier to put out a social media post making tall claims than it is to do the hours of research required to prove or debunk it. And in the case of health, non-medical folk, as most of us are simply not qualified to do that kind of research. This is not to say that we are not important stakeholders in the conversation on health. Instead, we are saying that this is a conversation that requires the inputs of experts who can weigh in with scientifically proven facts instead of anecdotal observations. Quick reminder that you can start this journey by listening to our limited series podcast Unviral that is linked in the description. And we practiced what we preached because on this show, we spoke to doctors and a few non-medical experts too to help us make sense of the misinformation around a few important health-related topics. With that, we come to the end of the 6th episode of Season 5 of Decode. We will see you next time with another topic from within the strange world of fake news. Until then, like and share this video. And subscribe to Factly if you haven't already so you can watch our daily fact checks and stay informed. Thank you for watching.